It's a great pleasure to be here today for this important occasion to officially break ground for the new Ba Hospital. Last October, my government signed a landmark Memorandum of Understanding facilitated by the Minister for Industry and Trade, sealing the public-private partnership for the construction of a brand new hospital for Fijians living in and around Ba, including Tavua, Rakiraki, and Lautoka. With that MOU, government joined forces with the Ba Chamber of Commerce, marking the first step of an ambitious capital project that has the potential to benefit around 140,000 people. I would like to once again thank the Ba Chamber of Commerce for its leadership and initiative. It is thanks in large part to its hard work and bold vision that we are breaking ground today. I often discuss the importance of public-private partnerships in delivering quality, efficiency, and transparency to the Fijian people, and the Ba Hospital is a perfect example of this. The spirit of collaboration and community on this project is truly commendable. Not only are the Ba Chamber of Commerce and the Ba Hospital Steering Committee playing a key role in partnering with government to ensure the successful completion of the new hospital, but a number of companies and professionals have also come on board and provided their expertise and services free of charge. To me, this strikes to the heart of the kind of place Ba is. Ba sets a wonderful example of how the values of community, tolerance, and understanding can triumph over the division, fear, and mistrust that some old politicians are clinging to. Yesterday, one of Fiji's main political parties claimed that Fijians can never be equal, a statement of the same brand of racism that has brought Fiji to its knees before. This party has finally revealed its true colors for all to witness, showing once and for all that it has not changed, despite repeated claims of multiracialism and unity. This statement demonstrates that this party does not believe in the fundamental human rights as set out in the UN Declaration. It demonstrates that it does not believe in the belief that all men and women are equal in the eyes of God. A party that does not believe in true equality and discriminates on the basis of race, ethnicity, and religion will also discriminate between rich and poor, rural and urban, able and disabled, young and old. Fijians should not only condemn this bigoted party, but also other parties aligned with it. Luckily, as I look around Ba and the community gathered here today in a spirit of unity and togetherness, I am reassured about just how wrong and just how backward looking this party is. We Fijians know that it's possible to enjoy a future of equality, justice, and prosperity for all. All we have to do is refuse those who are trying to drag us back to the divisions and discrimination of the past. Ladies and gentlemen, so far, work on the new Ba Hospital is progressing well. Early this year, professional design consultants were appointed, and I understand that the design concept is expected to be signed off on within the next couple of weeks. After that, the detailed design work will commence. Also, the tender for early civil works is expected to be awarded by next week, and the actual constructions is expected to begin as early as November this year. My government is always on the lookout for opportunities to form productive partnerships with communities and NGOs to improve the lives of our people. This alliance with the Ba Chamber of Commerce provides a great example of how such cooperation can work. The new Ba Hospital will be constructed to World Health Organization standards, and when it's complete in 2016, it will serve as a bridge between the smaller Tavu and Rakiraki hospitals and the larger Lautoka Hospital. It will replace the current facility in Ba, which has lived well beyond its years and is become increasingly expensive for government to continue to maintain to make it comply with the required standards. The new hospital will offer a range of crucial services, including a birthing unit, a 24-hour emergency facility, an X-ray and scan department, a laboratory, a dental unit, operating theaters, a mortuary, another mortuary for you people in Ba, and a pharmacy, amongst others. The total project represents an investment of around $30 million. Ladies and gentlemen, one of my fundamental beliefs is that all Fijians deserve access to quality and compassionate health care, no matter where they live or what their background is. In an ideal world, we would have unlimited resources to spend on boosting our health services. But I've always been very upfront and honest with the Fijian people about what we can do and what we cannot do in the health care arena. Unfortunately, this policy of honesty stands in the stark contrast with the politicians who are happy to tell the Fijian people that fixing the problems in health is as easy as a few simple reforms. I believe that Fijians are clever enough to see this for what it is, a bunch of meaningless talk. They understand how easy it is to rattle off nice-sounding promises in the bullet points of manifesto. However, it requires real leadership to deal with the reality on the ground and develop pragmatic, innovative solutions. The health sector does not need more promises. It needs smart leadership and strong, action-based decision-making. The one thing I will promise the Fijian people is this: my government will continue to constantly seek imaginative ways to overcome the problems we face, to enable us to meet an acceptable standard of healthcare for a country of our size and means. It's no secret that my government over the past 6 years has been playing a catch-up game in terms of the availability of equipment, of local specialists, nurses, professional health care givers, and more importantly, in the attitude of some medical staff to their professional duties and to the patients they serve. We understand that hospitals and healthcare centers are where babies enter the world, where our family members go to be healed, and where we often spend our final moments with loved ones. Therefore, we need a better level of sensitivity shown towards patients and their families during these important and often life-changing moments. But if any Fijian needs an indication of just how seriously we take our responsibility to improve Fiji's health services, the past week offers a fine example. Exactly 1 week ago, I was in Yalavou opening a brand new state-of-the-art hospital. Today, we are in Ba, breaking ground for a new hospital. And tomorrow, I will be in Lutoka to launch a refurbishment of the emergency department and operating theaters, as well as a hospital extension. On top of this, in Ba province alone, we are also planning the upgrade of the Ba Health Center, together with significant maintenance works at Yalavou Health Center and Namau Nursing Station. All told, no other government department has ever made the level. No other government has ever made the level and manner of investment that we have made and are still making in such a short period of time to deliver a better standard of healthcare in Fiji. Ladies and gentlemen, I would like to once again thank the Mba Chamber of Commerce, the new Mba Hospital Steering Committee, and the Ministry for Industry and Trade for all their hard work so far. With government support, I'm confident this project is in good hands. With those words, ladies and gentlemen, it is now my pleasure to do the groundbreaking for the new Mba Hospital.